Hi there. Hello, Ms. Melnikova.
Hello.
When I talk to people with diabetes and visit various forums, I often come across situations where the blood sugar level doesn't drop below 3.9. It's higher than that. And yet people experience hyposymptoms such as sudden hunger, weakness, and sweating. Are those actual or imaginary symptoms?
What an interesting question. Of course, doctors never doubt that symptoms described by patients with diabetes are real. On the other hand, people with diabetes tend to associate typical hypoglycemia-like symptoms you've just listed with hypoglycemia. But one should think, are there similar symptoms in people without diabetes?
If you haven't eaten for a while, there may be weakness.
For instance, sweating, tremor, anxiety, and panic. Does it ring a bell?
Blood pressure leaps.
Or some emotional stress, any kind of overstrain. People with diabetes tend to forget that certain unpleasant sensations they might experience are not necessarily associated with diabetes or fluctuations of blood glucose level. Many other factors can be mistaken for hypoglycemia. If there are hypo-like symptoms, but the glucose level is higher than the hypoglycemic one, this condition is called false hypoglycemia. The symptoms are there, however, the strategies normally applied for true hypoglycemia should not be applied in this case. In other words, do not eat fast-digesting carbs if the blood glucose level is higher than 3.9.
What do we do to avoid this kind of situation?
What do you think? If it's caused by stress or anxiety?
Avoid stress.
Good idea. Wouldn't that be great for all of us? We should at least try and assess the situation, connect the dots, calm down, and avoid carbs to eliminate the sensations, thus elevating the glucose level. Right? False hypoglycemia doesn't require consumption of fast-digesting carbs, which is normally the basic strategy for true hypoglycemia. This is the most important conclusion we make here. In some cases, I'd like to ask you a question again, not to test your awareness in this field, just to make you think logically. Imagine the glucose level was 20. The patient injects insulin and maybe eats some food. In 90 minutes, the blood glucose level is 8 and the person experiences hyposymptoms.
Due to a drastic drop?
Exactly, a significant drop within a short period of time. In your opinion, does it make sense that the person has these symptoms in this situation?
Yes, to avoid a further drop.
Obviously, a situation like that will provoke hypoglycemia-like symptoms should the person do something to feel better, to prevent the blood glucose level from dropping to a hypoglycemic one.
They should prevent the blood sugar from lowering. They should stop injecting insulin.
The insulin has already been injected, and it is acting.
Then eat something.
Yes, that's right. One should eat some extra carbs, an unscheduled snack, but not the fast-digesting carbs that significantly affect the blood glucose level. Just the carbs that regularly affect the blood glucose level. You see, one should eat something, but not the kind of food that is remedy for true hypoglycemia. So, as with all other things, there is no universal guide. To sum up, when experiencing hypo-like symptoms, choose a different strategy if you know that this is false hypoglycemia.
Thank you, Ms. Melnikova. Today, I learned a new term, false hypoglycemia.